Hello, I'm Kenneth Cutbush, an orthopaedic shoulder surgeon working in Brisbane. I'm with Lucy Angelini, physiotherapist today, shoulder physio, and we're talking about PEC major repairs. Have you ruptured your PEC major, or have you got a friend who has? Well, we're going to talk about what to expect after the operation, after you've had surgery for it. So Lucy, PEC major repairs, I guess we start off with, it's interesting, if you look at the literature, a lot of patients that have PEC major ruptures don't do too badly with rehab and physio rather than surgery, don't they? But my philosophy is always, in most of the time, to fix these. I think people do better long term if we fix your PEC major.
And aesthetically as well.
Yes.
They're often interested in making sure it looks as good as it
can. And strength in the gym, all of those things. Usually we're talking about someone fairly athletic, that's
young,
trauma, young, active, sporty men.
Typically,
yeah.
So
live up to their PEC.
Yeah.
So my philosophy is to fix the PEC major, and that will be an open repair. The incision will be at this level here, and we get the PEC major and bring it across and put it back onto where it is. And typically that's put on with anchors, little titanium buttons that go into the humerus. There are different ways to fix it. That's my current technique. And then you'll be in hospital for one night after that operation. Next morning, the nurse will check your dressing. Typically, it won't need to be changed, and you'll see the physiotherapist, and you'll be in a sling.
The first 6 weeks you're in a sling. We're making sure that you don't engage the PEC, so because we want to protect that repair. So no sort of pushing, really careful education in terms of not actively using your PEC. We want to make sure that the joints themselves don't stiffen up too much as a result of being in the sling. So we want to make sure your hand and your elbow and your neck and your shoulder have got some good passive range of motion. So we'll show you some little stretches to do. We'll also make you aware of your scapular posture, which is really important because you'll tend to want to protect that PEC. So we really want to make sure that you have a nice open chest. But physio early on for this is quite low key. We're just protecting the repair and making sure it gets a chance to heal.
Yeah. And a sling, you don't need a bolster. That can be taken off and just have the sling across. Whatever's more comfortable, actually, is the way I think about it.
Yes, and the physios before you leave will make sure that you're independent with taking it on and off so that you can shower and dress yourself.
Yeah, so make sure you go through that with the physio, how to put the sling on and off, how to have a shower, how to get dressed, and how to do that safely.
It's all very important.
Yeah. At this hospital, you leave about 10 a.m. You're then going to be in the sling for 6 weeks. You can't drive during that period of time, and we will see you back for the first visit at 6 weeks. When should they see their physio in between that time?
So normally about the 2-week mark, you could go and see your physio. They'll check the wound and make sure everything looks good. Go over your exercises because often there's a lot of things going on when you're in hospital. So it's good to have a refresher and just make sure that you're aware not to engage the PEC. That's the major thing.
And your physio will have details from my office of the operation and the rehab protocol. That will also be in your post-op pack, so take that with you. And there's the video that I do explaining the operation. Take that along as well. That's very helpful for the physios, isn't it, to get on board with where we're up to with you.
Absolutely. Yeah.
So the big thing is just not to strain the PEC major repair, isn't it? So 6 weeks in a sling.
Yep.
What I find culturally out there is a lot of patients that I see, they've got a mate who knows a mate, and they only went in a sling for 6 weeks and they're back playing footy at 8 weeks. I think that's a mistake. I think you're just too likely to stretch it up and get a very poor quality result. If you're going to do the surgery, for me, it's 3 months of doing nothing. 6 weeks in a sling full time, come out of the sling at 6 weeks, but we're not doing anything very active in terms of stressing that repair because it will stretch up. That's been my experience.
Yeah, absolutely. So the first 6 weeks, very quiet. The second 6 weeks, so week 6 to 12, you can come out of the sling and use your arm for all your normal day-to-day activities, but there's still care with any forceful kind of pushing. Yeah, so opening doors, leaning on benches. You've just got to be aware that you're not doing any forceful pushing.
Now, the next visit is at 12 weeks. What are we doing then?
And that's exciting because we get to start strengthening then.
Yeah.
So by 12 weeks, we're hoping that your shoulder's pretty comfortable, that you're moving quite well. You probably won't have full range of motion, but close to it. And we get to start strengthening the PEC. So in the phase 2, week 6 to week 12, you can do a little bit of strengthening of other muscles, but we really avoid loading the PEC until week 12.
Yep. question.
Yep, the money one. So you leave that maximal lift until 6 months, but you spend the 3 months gradually building up to that. So, yeah. Yeah.
So that's PEC major repairs. Most of these we see acutely, don't we? But I see patients that are years down the track and have had a PEC major. Well, what I see is two things. One, it's not been really recognised what it was, and we do a scan and we see it was a big PEC major tear. I certainly see those. And other ones that I see are ones that have been repaired, but they haven't been advised to be careful with it post-op, and they've retorn. And they're never quite the same. And they've sort of lived with it, and you see them and they're not happy with the shoulder. And my experience is, yes, we can repair them acutely, but I've also very familiar with repairing them down the track, years down the track. And normally that's possible to do. I've never used a graft. It is possible to repair them primarily, and we can get a good result for them. And the post-op rehab is the same. Anything else we've missed there?
No, but typically it is a younger athletic population, and so they're very keen to return to sport. So just managing...
We've got to manage their expectations.
Yes, yeah.
So there you have. If you've ruptured your PEC major and you're contemplating surgery, that's what you're going to face after the operation. You need to be aware of what you're up for. Thank you for listening.